Thank you, Susan. So hi, everyone. We're really happy to have you today to officially launch the new platform at Core, which is going to be the capture and optimization of the research data. This platform was gratefully supported by the MGH Foundation, and the objective will be to provide consultation and support for the conceptualization and organization of data for all the PI at the RI, and also to support them in usability, harmonization, or any programming within electronic data capture system. So the objective will be to support the whole RI community with a professional data management capacity. And for that, we have Isabel Fortier, who's going to be the scientific director of the platform, which is also a principal investigator here at the RI. She currently leads the Maelstrom research platform, which already provide the international research community with such expertise related to leverage and support data harmonization and integration. And we are also pleased to have on board a new employee, which is Lovemine Jeannot, which is going to be the project manager of the platform also as well. She has a background in public health and epidemiology, and in the past, she worked on different clinical research studies, and is also going to be responsible to collaborate with the PI from the project from the beginning till the end. So without further ado, I'm leaving that to Isabel and Lovemine. And we also have Rita Wissa, who works with Isabel within the Maelstrom group, who's going to provide you some example of the kind of project they took over the past years, which is going to be look more or less like the one we're looking forward to have within the platform. So go ahead, Isabel. You're on mute. Okay, great.
Okay, so I'm gonna start since I'm gonna be starting the presentation. Yeah. So first, thank you, Dr. Favreau, for introducing us today, and thank you for everyone who's joining us this afternoon. Let me just make sure the slides. Okay. So first, I want to give you an overview of the situation at the core currently. So there's a broad range of the research project being conducted at the core. So some of these projects vary from clinical trial, cross-sectional studies, cohort, case control studies. A lot of these projects involve recruitment of human participants, and recruitment of these participants can vary from less than 50 to more than several thousand. So while some studies have sample data collection, for others, the data collection is much more complex. So there's complex recruitment ongoing, data acquisition framework to think about participant follow-up, linkage across database, and sharing of data across multiple collection centers. So in order to optimize their impact, the study will need to be more, they must be cost effective, and they must be based on rigorous scientific principle. So each step of the research data life cycle brings its own challenge, and it can be very challenging for investigators and their research team, because oftentimes answer to their question or the cost-effective solution that they are looking for aren't readily available. So this is where the CODE platform comes in. So we aim to provide resources to support investigators and their team in the implementation and the management of data-related operation across all phases of the data lifecycle. So what we want to offer you is one, expertise in data-related operations. This includes construction of case report form and participant questionnaire, implementation of data cleaning management procedures, and development of cost-effective infrastructure. Two, we want to provide you with technical support to complete certain tasks that may require specialized expertise. For example, when you have to go in RegCap to enter your your data collection tools. So you may require support in that aspect. Or for example, if you have a trial and there's a randomization involved, and in collaboration with the biostatistic unit, we can work with them and upload the randomization table for you in REDCap. Also, third, we want to give you access to specialized software, either at no cost or at low cost. For example, we're talking about REDCap, Opal, and other software available for data management. And lastly, we want to provide you with the methodological tools. So either we have investigators who have the staff who's able to complete certain aspect of the data management, but they may require some training. So our platform is able to provide you assistance in that capacity. So some example of support of service that we provide. We can review and assist you in the development and evaluation, of course, for your data capture. So if you come to us while you're working on your grant submission, we can set up a virtual consultation where we sit down with you and just like help you develop cost estimation for your data management need. And when it comes to the case report form, we can have a look at your questionnaire, participant questionnaire, or your case report form. So making sure, for example, that the questions are asked properly across language. So if you have a database where you have a questionnaire being sent to participant in French and English, so you want to make sure if the questions are being asked in English, the way you have it formulated in French means exactly the same thing. So you don't have a conflict in all the data is being collected. We can also provide you service in implementation of your project in REDCap. Just like I said before, if you need help creating a data dictionary, when you have to enter your form in REDCap, like we can assist you in setting the minimal, maximal values, integrating calculate fields. So a wide range of service that we can provide you. Also, we can support you in installing software that you would need for your data management, like Opal or, and if you need guideline, that is something that we can provide to you as well. So since 2020, the court started its pilot phase. And during this phase, a major activity that we conducted was to work on the upgrading of REDCap. We've upgraded to version 11.119. This is a process that took us approximately 5 months. It's a very tedious process that was done in 3 phases where we had to test, validate, and do the project production phase. And throughout that process, we made sure to consult with the IT department and the quality assurance department just to ensure that the process ran seamlessly so that it did not impact the active project in REDCap, because sometimes that could happen during upgrade of a software that it does impact project negatively. And currently we ensure the support to over 376 active projects in REDCap. So in our pilot phase, what we've noticed is we have 2 types of users on REDCap. We have those who are feel comfortable enough where they just need access to a project in REDCap so they can develop the database themselves and do any aspect of the data management themselves. And we have those who do request access to a project in REDCap but would like the court to support them in either implementing their questionnaire or different aspect of data management. So just to give you an overview of project last year, so REDCap has been used at the RI since about 2014. So throughout those years, we've opened 521 projects in REDCap. So during the pilot phase, we have about 200 projects that we opened from 2020 to 2021. And to give you a overall status, so in REDCap, we have those projects that we considered as active and projects that we consider as archive. So active projects are those that are either in production mode, meaning that they are capturing data in real time, and projects that are in development. So either the core team is working on developing the forms in REDCap, or the research team is doing it on their own, but they are not yet ready to capture actual data. So the majority of our project right now are active, and we have about 28% that have been archived. And most of the project in REDCap are used for research related purpose, but there are some occurrence of people using REDCap to collect data to support their for quality improvement or operational support. And on average, our technicians spend about 30 hours a week managing active project in REDCap. And when I say managing, what I mean by that is opening a project in REDCap, depending on the parameter of the research project, to set that up, and assigning user role if there's a user that needs to be given specific to a specific data access group. All of that is handled by our data administrator, or REDCap administrator, and they fall under project management. At the moment, we have about 986 active users in REDCap, and the median number of users per project in REDCap is about 5 users. And we also provide technical support for those users, and we spend about 30 hours doing 30 hours a week doing technical support, and technical support could involve creating assisting users in creating branching logic for their project. If they have to, for example, standardized questionnaire where there's a scoring involved and they need to implement those, what do you call that? Those, I'm trying to think of the word, those calculated fields. So we can provide you that support. And so all of these hours, when they say 30 hours, this is what it represents. So another thing that I want to mention to you during our pilot testing is we had other users who came to us, but not only for REDCap, but they needed support for different services. So this table is a visual representation of type of service that users came to us. So we have them categorized in 4 majors category. So implementation of data in REDCap, implementation of data infrastructure, monitoring of data collection, and ensuring data management. So this is based on 26 projects that approached us, and they do not include people who requested access to REDCap so they can develop the project themselves. So these were people who wanted our expertise and technical support. So you see that the majority of service requested, a lot of it involved implementation of data in REDCap, and we had about 22 of request services involving data implementation in REDCap, and about half the project, about 13 required support in data management. And you see that when people come to us, it's just not for one type of service. Usually it's a mix of different service. And next, I want you guys an example. And we work with the Maelstrom research team during the pilot phase because we did not have yet the capacity to manage the data management. So Rita is gonna take the lead next, and she will give you an example of simple project that we work on during the pilot phase.
Thank you. So like Lovemine mentioned, Maelstrom Research helped pilot these types of projects that CORD would essentially be in charge of. And the example I will give is the BETTER project. So BETTER is a registry of patients with type 1 diabetes in Quebec. There's three main objectives for the project. The first objective is to provide a portrait of the population with type 1 diabetes in Quebec in terms of demographics, treatment, frequency of hypoglycemia, life habits, and other aspects. Another objective is to measure the frequency and severity of hypoglycemic episodes. And finally, to evaluate the potential of new technologies and therapies to prevent hypoglycemic episodes. Currently, there's over 2,300 patients in the registry. These participants are divided into two types. There's the adults, which consist of participants aging 14 years old and older. So they respond to the questionnaires themselves. And the other group are children, so under 14 years old, where the parents are the ones that respond to the questionnaires. But once they turn 14, they're invited to participate as adults in the registry. There is core data collected for all the participants, and there's additional collection for certain subgroups of the participants, but we'll look into that in future slides. Next slide, please. So I think it was 2018, the BETTER team had a vision of creating a registry of patients with type 1 diabetes in Quebec. They knew that they would come across several challenges and they needed help in different aspects of this project. So they came to us to discuss the sensitivity of dealing with patient level data and how to manage that aspect. They needed help with creating the questionnaires. So Lovemine earlier mentioned, validating French and English questionnaires. That's a big part of it as well, to make sure that you can pull the data together. So we help them construct the two questionnaires identically and guide them in the implementation in the questionnaires in REDCap. We help them construct the whole infrastructure of the monitoring project, advise them on how to clean data and maintain and update the database, and then finally to extract subsets of the periodic releases of the registry for specific research use. Next slide, please. So before getting into the details of the data management, which is, I think, why everybody is here, I'll just put you guys into context of the project. So the data collection structure, participants are invited to join the registry via online link. They complete the phase 1 questionnaire. Once they complete phase 1, they're asked if they'd like to move on to phase 2 or leave it there. If they decide to stop, then they can be contacted in the future for other sub-studies if they've consented to that. If they've agreed to move on to phase 2, there are two questionnaires. There's a phase 2 questionnaire and then a phase 2 additional questions 6 months later. When they've completed phase 2, they're also asked if they would like to stop at phase 2 or continue to phase 3. If they decide to stop, then their follow-ups will also be phase 2 questionnaires, so similar questionnaires administered every year, or they will be asked whether they would like to continue with phase 2 or move on to the phase 3 group for their follow-ups. Back to baseline, if they had said they're willing to continue to phase 3, that entails another questionnaire. They are also sent a pedometer to wear for 2 weeks. They're invited to answer a 24 recall nutrition questionnaire. They're sent a ribbon to measure their waist and enter that into REDCap. They're invited to share their list of medication and their recent lab results. Everybody who went all the way to phase 3 for the follow-up 3 years will redo phase 3 at follow-up. So as you can see, not all of the participants had the same life course in the project. You have participants who only had phase 1, some participants who have phase 2, but then also phase 3 later on, some who continued just with phase 2 for the whole life course, and others who made it all the way to phase 3 from the beginning and continued with phase 3. for their follow-ups. Next slide, please. So several subpopulations in the registry. Now, to add another complicated layer to that, you can sometimes modify your questionnaire as well. So it has happened where there was a new treatment on the market and they wanted to capture that in their questionnaires. So we moved on from an initial version of the baseline questionnaire to a second version that would include questions on the new treatment available. So in this case, for example, originally they only had injectable glucagon, and there was a possibility now of the nasal one. So they had to ask questions on, do you use the injectable or nasal? And that modified this whole section of questions in the questionnaire. That's not a problem per se. The only thing is, when you want to do your analyses later on, ideally you would have one population to run your scripts on. But in this case, we can't simply combine everybody who answered the first version and the second version, because we need to understand why, for example, the first 1,000 participants have missing values for the question of nasal glucagon. It's just because it wasn't available to them at the time. All this just complexifies the data management of the project, but it doesn't make it impossible. It just means that good procedures are needed, good SOPs, protocols, and documentation is super important. Next slide, please. So now for the data management structure. Most of the data comes from REDCap. So the main questionnaires are through the survey link and entered into REDCap. There's the English and the French projects that would need to be combined, but they're not combined in REDCap. Then there's the biosample report, waist circumference, and medication list that are entered by a research assistant into REDCap in their own specific project as well, or in their own specific forms, I mean. And then all that is pulled into Opal, which is a data warehousing software, part of the Obiba suite of software. In Opal, so at this point, we've imported the data from REDCap. We also upload data coming from the other sources. So the nutrition data is a CSV that's exported from a software where they responded to the 24-hour recall. The pedometer data used to be a CSV, now it's also entered in REDCap, but that's details for now. But that comes from a different source as well and is uploaded to Opal. And with time, yes, that's a good point. The Opal is from the Obiba suite of software, which is different from John Kildia's patient portal Opal. That's an important point. So recently, they've also added data from Health Ministry, so socio-health data. That's also a CSV file that's uploaded to Opal. So we warehouse the data there on a secured server, but then that's not practical to do all the data cleaning and all the merging, so manipulating the data. So we need to merge the English and French. That's the first thing. Then we need to watch out for the outliers, do some validation checks, some quality assessments, and generate the reports and the final data tables. All that is done in our studio, which is also on a secured server. Once we have the final outputs ready, we then upload them back to Opal in specific folders where the Better Data Manager has access to then share the data with approved users for specific research projects. Next slide, please. So data comes from all kinds of sources and in all kinds of forms. So the pre-processing step is super important. There's a lot of data cleaning to be done. We can see some of them look like proper data tables. Others have merge cells from the CSV files, merge cells, empty cells. So there's a big data cleaning process that needs to be done before you can even think of linking all these different data from the different sources into one data set for use later on. Next slide, please. So this is what it looks like in this Opal. So we've created a folder for the input files where the Better Data Manager puts all the files that we need. So there's a master ID list, which is the file we use to track which participants are eligible for the release of the data that's ongoing right now. Who needs to be excluded, who needs to be added. There's also the list of the outlier conditions. So there's the conditions that need to be respected. So for example, variable X could never, the value of variable X could never exceed the value of variable Y. That needs to be noted somewhere for us to be able to do that manipulation and produce all these reports to maintain the quality of the data. Once everything and the magic happens in R, the outputs that we push back to Opal for their access, there's the data tables, and as you can see, they're divided by the subpopulations because of all the complexities, and the quality reports. So there's the outlier reports, so all the identifiers that are flagged and didn't respect the conditions that were predefined, or some visual reports, so descriptive statistics of all the variables to continually assess the quality of the registry. Next slide, please. So this is a collaborative workflow. The goal is not to make these scientific decisions for the research team. They understand their topic, they understand what they need. They just need our help to get there. So all these input files need to come from them, obviously with our support. And so again, it's a collaborative workflow. So they provide all these documents, and then we would validate them before we run any scripts to make sure that they're in the format that we need. And it's an ongoing process back and forth. Once we have everything we need, we do a first release, so a first export, where we provide the initial reports so that the better team can then assess and decide what to do with that information. So if there's an outlier, it doesn't necessarily mean it needs to be excluded or changed. They could decide that this outlier is okay, it's the proper value, we'll keep it as is, and we just know that it's an outlier. They could also contact patients, because we do these exports every 3 to 4 months, so they can contact patients to double check, was that the value that you intended to enter, or was this a mistake? Once they've taken all these decisions, they make the appropriate corrections, and then we do another export now with the corrected data. And then we provide, in the end, the data tables for each population, like you saw, the data dictionaries for each data table to understand what each table is about, the visual reports, and then just to kind of give a final package and for documentation purposes, we include the outliers conditions that were used for this release, the types of cleaning rules that were used. So a lot of times we need to do some calculations and derive some variables that is a bit complicated to do in REDCap because it takes several steps of manipulation, and it's easier to do it in R. So all these derived variables need to be documented. So that's what we call like the cleaning rules, for example. And the list of IDs that were eligible for this release. In case we need to reproduce this release later on, we have this all packaged into a folder in Opal on a secured server where the Better Data Manager has access. Next slide, please. So essentially, they had this vision and needed a way to get there. And the way we helped them get there was by going through these different aspects of the project. We helped them with the implementation, with the data collection, the data management, the infrastructure, the data monitoring, and the data curating. So we do help them create the subsets for each accepted user research project. So this structure is true for many, many projects. Next slide, please. Better is a pretty big project. It's ongoing. It's building a registry. There's a lot of subpopulations and a lot of questionnaires and data coming from a lot of different sources. But the same I used in on a smaller scale. For example, during the pilot phase for CORD, we also helped with the SunFit project. So it's the Sun Awareness and Melanoma project, and the PI is Dr. Litvinov. And they came to us needing help with also implementation, data collection, data management, and infrastructure, but on a much smaller scale. So they managed a big part of it themselves, and we were mainly there for support. And we generated a lot of the scripts that they use, but they learned to use them and really just wanted our support. So that's also possible, but there are different needs that can be, so there's different needs for different projects, but there's a lot of similarities between them. Next slide, please. So what did we learn from this pilot phase? The biggest takeaway, so I'll start with the biggest takeaway. If you need to remember one thing, is that it's really important to contact CORD from the very beginning of your project. If CORD is contacted at the initiation phase, they will help you with on every step of the way. They'll help you with, to help estimate the cost, budgeting for a project. A lot of people underestimate the cost and resources it takes to properly manage data, and they find themselves at the end of the project with little resources left to do that. So if CORD is involved from the beginning, they'll help with the budgeting, they'll help with writing all the protocols for structuring the project and getting the project started on the right foot. So that's, I would say, the main takeaway. There's a broad range of very specific needs for each research initiative. There's different types of data that are handled. Data is not just limited to collected data. A project can use data from, for example, StatCan. That's an existing data set available to all, but that still needs data management. It still needs to be cleaned and manipulated before it can be used for analyses. There's, REDCap is great for data collection, and it's a very useful tool, but data management is not limited to REDCap. There's a whole world of data management outside of it, and there was a big need for expertise on that in that sense. It was very needed to, where to warehouse the data, where to set the infrastructure and manipulate all the data. And access to a central repository of methodological tools. It would be helpful to have the guidelines, SOPs, and protocols for the beginning of projects as well. And there's a lot of work that will be required to prioritize resources to be developed and to build a solid support team. So it will take time, but we will get there for sure.
So my turn. So just the word of the end to remind you that it's always the same story. So you have a PI that is having an idea, apply for funding and hopefully get the funds. Then start the implementation phase where you launch the activities. So you will have to define the data sources and the type of information you need, develop your questionnaire, your SOPs, develop the warehousing infrastructure, as well as pilot all that to be ready to start collection. Then start what we call the production phase, where or you collect the data or you extract the data from existing resources, integrate everything, make sure you ensure the quality control, then preserve the data set for long-term usage. So for extraction to by different user to achieve analysis and generate papers. So next, please. So throughout that process, I don't know if you saw, but you have little stars everywhere. So data management questions are arising across all of the steps. But what is the key element that you need to keep in mind is first, you should always aim to have the data of the highest quality as possible. Aim as well to establish a cost-efficient infrastructure, but that is adapted to your specific need. Like it can be particularly simple or more complex, as mentioned. Implement rigorous processes and quality control and ensure proper documentation. Low quality on any of that will lead to increased effort, increased cost. You will have to reinvent the wheel each time and lead to less results, less paper, less impact of your research project. Next, please. So let's take just 1 minute to talk about the variable per se, or the data per se. It's more than just developing a questionnaire. You need to sit down and think about each information you want to collect. Establish the list of information, but as well the definition. If we take the weight, okay, what is weight? Is it in pound? Do you want to collect the weight in kilogram, in pounds, or offer the participant to answer to or kilogram or pounds? What is the format? Is it an open format, or you will want to limit to 2 numbers before the comma and 1 after? What is the nature of the weight? Do you need the weight collected, reported, or by the participant, or the weight reported, collected by the nurse, or what are the SOPs that collect the information about the weight? So it's important to think about those variables. And if we take, for example, the type of cancer, that information, you can offer for that information, have a format of the variable that it will be first type of cancer with 1 choice, so breast, colon, etc. Second type of cancer, third type of cancer, or you will want to have type of cancer and offer multiple choices. So I can choose breast and liver. And if it's the case and you have multiple choices, do you want just a check, or you want a yes, no, or don't know for each of these information? So that will influence the way behind the scene your data set will be generated. And you need to think about those things when you start before starting the collection, thinking about in 5 years, 10 years, what you will need to use in terms of the structure of the data for the analysis. So that can be particularly challenging. And the other example is the pain in breast. No, right, left, new. It's a real question, but that is not one variable. That is, you should have pain in breast, yes or no. If yes, right, left, or you should select right and left. And if it's right, is it the onset, or if it's a new pain or an old pain? So it's really important to think about all those aspects. And define the rules as well to ensure quality. If we take just the 0 and 1 with 4 yes and no, is it 0 is no, 1 is yes, or 1 is no, 0 is yes? And please don't change through the questionnaire. For sometimes I have 0, 1, and sometimes 1, 0. That can happen. And will you want to have as well a specific code for the prefer not to answer or the don't know, to offer the possibility to the participant to select those? So all that need to be taken into account. Next, please. You then have, as I mentioned, the data infrastructure. Sometimes you will just collect information in REDCap and extract to do your analysis, and that's fine. But you could have as well the necessity, like Rita mentioned, to extract the data outside of REDCap to be able to do some additional cleaning or some integration across different data sets. The software you're using for that storage integration phase can be the same or different from the software you will use for the analysis. Then you have all the aspect of managing the access to the data. I can perhaps have access to some sensitive information, but someone else couldn't have access to that information. And who is accessing what data when is particularly important to think about those aspects. And finally, for some project, you could have the necessity to generate a website where you will have a describing the data collected for the user to be able to ask for access to the data. So it can be really complex or really simple. Both are possible. What is really important is to think about all of those aspects to make sure the infrastructure you're implementing is the right one for you and will be able to be the right one in 5 years or in 10 years for all the duration of the project. Next, please. Other aspect is the monitoring and quality control. So it's not just REDCap. You will need to do some cleaning, often outside of REDCap, like mentioned. But for example, for the monitoring, if you follow participants daily, weekly, or just after 6 months, if you wait 6 months before looking at the data, that means that you will probably not be able to go back to the participant and adjust or correct the information. How will you as well manage the withdrawal of the participants? So those aspects of monitoring need to be think of, as well as the quality control. Like I mentioned, if you wait too long before looking at your data, perhaps you will have to delete some information because not able to correct the information. And something that is particularly important is, I think it's, you should always implement a step where you will generate a clean data set and not extract the data from REDCap and send it to the fellow one, and extract the data from the REDCap and send it to the fellow two. And because at the end of the day, each person analyzing the data will have to reinvent the wheel, to reclaim the data, to re-understand the data. So that is something that the generating and maintenance of the clean data set is something that is particularly important. Next, please. Finally, the documentation and access. If you collect data without documenting it properly, what will happen is that in 6 months, someone will ask you a question about the data collected, and you will not you will have forgotten the how the data was collected. So what were the zeros and the ones, or how the I don't know, indicator of the level of activity was generated. So every step every variable need to be documented, but every transformation of the variable need to be documented as well. For someone that will receive your data set, to be able in a couple of hours to understand the content and use the content properly, instead of passing 2 months to try to figure out what the variable are meaning. And I'll here give you an example of a project we worked with. It was a project across Canada, and the user at one point was so happy because they discovered that the prevalence of cancer in Alberta was so low. But it was because that specific center excluded participants with cancer at recruitment. So the user that will use the data needed to have that information and to be able to use the data properly. So next, please. So we will ask you different questions if you come to us, and I would just want to stop here and say and remind that there are 2 types of users. You can come to us just to have, you know, a guideline that you will use and deal with them yourself, or you can come to us and ask for technician to help you in the process. So it can be just expertise or tools, or it can be specific support. But what we will do, we will ask you different questions. It can be about the number of participants and from how many centers the participants are recruited, because that can influence the structure of the data collection environment. We can ask you as well question about the data sources and how they will collected, how they will dealt. because that will influence if you will use just REDCap or you will need another software. We will also ask you a question about the user. Who will have access to data? Are you planning to send an Excel file in an email with the data set? Or you will have a secure environment, and who will say that it's okay for that person to access the data? So you need to think about all those aspects. So next, please. So CORD aim to help you concretely to think about those things. And if you need, just if you need, help you to technically take care of all those aspects. Next, please. So it's the CORD to the moon, with Lovemine going to the moon. So we are currently, you have Dominique that is leading all the admin aspect, and I'm leading the scientific aspect, and Lovemine is coordinating the operation. On the admin team, we also have Kim and Sophia that are helping for the administrative aspect. Vasil and Sukanya are maintaining mainly REDCap, but also helping in the data cleaning and management aspect. And up to now, we have the Maelstrom team trying to support, to provide the additional hands and mind to support CORD. But hopefully we will recruit new people only concentrating on CORD in the future. Next, please. So we are ready to launch, but we need to make sure to reorganize the services based on what we learned in the pilot phase. So that means evaluate cost for specific services that will, new services that will be required, but as well update the forms that we are using for quotation and service agreement. We're working on that. Implement as well a more efficient workflow for the management of the demand. Something we would like to do is to recruit an advisory committee. So if you're interested, contact us. And as well, reorganize the technical assistance. Like I mentioned, Maelstrom was trying to help, but we need to organize the support more in a more solid way. We know what we need to do, it's just that we need to do it this year. And finally, as we mentioned earlier, sometimes the PI want to do the work themselves, but it would be helpful for them, for example, to have access to a R package for the data cleaning. So it can be particularly helpful, or a template for the documentation of the data dictionaries or things like that. Some tools that could be helpful for you to facilitate your work and work independently. So that would be extremely helpful to have your input as well on the specific tools you would like to have, specific guidelines you will ask like us to develop to support you achieving the work. So thank you. And I think we have a couple of minutes for some questions, or if you have ideas on specific tools you would like us to develop, that we can discuss this as well.
Thank you, Isabel, Lovemine, and Rita. So we have a couple of time for questions. So I see, oh, okay, I see that. Go ahead, Dan.
Sure. Thank you. Thank you. Thanks very much. That was just incredible. I guess I have a very pragmatic question just to clarify for understanding. Isabel, we've started working together on various grants, and it seems like I did what you encouraged us to do with CORD, which is contact you early for Maelstrom services for our grant. And so far, I've done this on 2 grants, and I was very happy with it. I just wanted to understand, how will that change? Is it that from now on, for the next grant, we would contact CORD for that, or rather than Maelstrom, direct to you as a collaborator? Is that what it is? But still, I mean, costing and stuff would probably be similar, right?
Yeah, yeah. In fact, I have 2 hats. Okay, the Maelstrom app is when you need to harmonize data. So when you collect different data at different places and you want to harmonize, that's what I'm doing since 2004. Okay, so that's my research activity. But in doing that, the team learned a lot of things linked to data cleaning and all that. So that's why Maelstrom supported the piloting phase of CORD, because there was not enough staff in CORD to pilot and have all the resources that were required. So when you need to harmonize, it will be Maelstrom. When you need to build a project, whatever it is, it will be CORD. And anyway, if there is a mix, we will talk, Lovemine and I, and solve it, and we will send it. You know, sometimes it can be Rita, sometimes it can be Lovemine that will be your main contact person. But the difference with CORD and Maelstrom is CORD is for one project. Maelstrom is for integrating different projects across organizations.
May I ask a quick second question?
Yeah.
Unrelated, and that is, in all the services provided by CORD, is there or will there be a data federation and synthetic data creation included or not?
Not really, but if it's something kind of tools that you think we should work on, we could discuss that further. Currently, it's mainly, you know, support with RedCap, support with data management, support with support being, again, we do the work for you, or we provide you tools to facilitate your life doing it yourself. But the tools to support you doing it yourself, I'm not sure exactly what are your needs. So that is something we absolutely need your feedback to help us identify what we should focus on for the development of those resources.
Thank you.
Thank you, Dan. Do we have any other question for people? We have some time still. No? Okay. So Isabel, I can give you the last word before we leave.
Right. First thing, if you have questions or if you need help, do not hesitate to contact Lovemine. The email is there. But we also need your feedback for two things. Okay, it's a new team. You know, it's not true that the first day we are 100% performant. We will need time. So we would like, again, I want to emphasize on the fact that if you need, I don't know, the guideline for data cleaning, okay, the list of steps you need to do to clean data, or our package, like I mentioned, that could be helpful, or I don't know, whatever you need, please tell us, because we will make sure to prioritize those demands. If not, we will develop what we think is the most helpful, but that doesn't mean that it will be what you're looking for. So contact as well Lovemine if you would like us to work on something, specific tool that you need. And as well, if you have, you know, feedback on the type of support we are providing, with the, you know, what you would like us to improve in the flow or in the questions we, the way we are dealing with you, it's the right time to tell us as well for us to improve and adjust to the support we are providing. So what you need in terms of generic tools, but what is your experience as well with us? You know, we know Lovemine spoke about 26 projects, but was it a good experience or not? Or what went well and what went less well, for us to be able to improve as much as possible? So thanks.
I have a quick question from Teresa in the chat. She's asking if there's a difference between cord and the hospital data.
Cord is not a data set, it's just an expert team to provide support. So there is no, the IT aspect is, or the data set is not our mandate, it's the mandate of the project.
A little bit like Kaberi is mentioning in the chat, like we're not going to be hosting data
No.
for the hospital or on behalf of others. However, we can interface with different kind of data sources, and accessing the data from the hospital, the data warehouse is currently an active project that we have at core with Kaberi and a lot of different other stakeholders. So those will be part of the pool of data from which we can help you work with, but accessing those data in the first place is not really the mandate of the core, but it's still mandate of the core management and directorship that we're trying to work on. But in the end, we try to reconcile all of that together. Perfect. And thank you, Isabel, Lovemine, and Rita. And as always, everybody, if you have any question and you didn't have the time to catch all the emails or information that are there, don't hesitate to contact me. You all know where I am. And also your core assistant or Kaberi, we can always guide you or help you to find the right platform for you. And I think it's also worth mentioning that we already have the biostatistical consulting unit at the core, and Raman, who's a scientific director of the platform, will also be interfacing with the core unit also as well, because from the moment that you have your data from the beginning to the output, then you move on to analysis. So there's actually a whole workflow between those units that will also happen. So don't hesitate to contact us if you have any question or integration. Great. Thank you, everybody.
Thanks.
Have a good